How does survivorship planning incorporate genetic testing results? When we think about survivorship planning, especially for those who have battled bone cancer, genetic testing plays a crucial role. Survivorship planning is all about managing the long-term health and quality of life for cancer survivors after their treatment is done. By integrating genetic testing results, healthcare providers can personalize follow-up care and risk assessments. Genetic testing helps identify inherited mutations or predispositions that may have influenced the development of bone cancer or could increase the risk of future cancers. This information is vital for several reasons. First, it allows for a more accurate risk assessment for cancer recurrence or the development of secondary cancers. For instance, mutations in specific genes like TP53 or RB1 can signal a higher risk of cancer returning or new cancers appearing. With this knowledge, survivors can have tailored surveillance protocols, which may include more frequent imaging or blood tests to catch any issues early. Next, personalized surveillance and screening become essential. Survivors with certain hereditary cancer syndromes might need to follow a customized screening schedule that goes beyond standard guidelines. This could mean undergoing whole-body magnetic resonance imaging or additional scans to monitor for tumors in other areas. Early detection can significantly improve outcomes. Another important aspect is family risk communication. Genetic testing results can indicate whether the cancer has a hereditary component. This can lead to discussions about testing and counseling for family members, helping identify relatives who may be at risk and could benefit from preventive measures or early screenings. Lifestyle recommendations also come into play. Survivorship plans can include guidance on avoiding radiation exposure or harmful substances based on genetic susceptibility. Genetic counseling helps survivors understand how their genetics impact their health risks, aiding them in making informed decisions about preventive strategies. If a survivor faces a recurrence or develops a new cancer, the genetic testing results can guide treatment decisions. This can include eligibility for targeted therapies or clinical trials that focus on specific genetic vulnerabilities. Lastly, the emotional aspect of learning about genetic risks cannot be overlooked. Survivorship planning often includes access to genetic counselors and psychological support to help survivors navigate the emotional challenges that may arise from understanding their genetic information. In the context of bone cancer, genetic testing is particularly relevant due to certain inherited syndromes associated with a higher risk of bone cancer. By incorporating genetic testing results into survivorship planning, healthcare providers can create a personalized roadmap for each survivor. This approach aligns with the growing emphasis on personalized medicine and comprehensive long-term care for cancer survivors, ultimately improving their health outcomes and quality of life.